The World Health Organization says at least one child has died in connection with the mysterious outbreak of severe hepatitis, a serious liver infection affecting children in the United States and in Europe. At least 169 cases have been reported in 12 countries. 17 children worldwide needed liver transplants. In the United States, Alabama has reported 9 cases in children under 10 years old. 2 required transplants. 2 cases were reported in North Carolina. All were reported in otherwise healthy children. The CDC issued a nationwide alert warning parents and doctors to be on the lookout for symptoms associated with hepatitis. CBS News chief medical correspondent Dr. Jon LaPook is here with us this morning. John, good morning. Good to see you. All right, so how concerning is this for parents?
Well, it's still relatively rare, right? Fewer than 200 cases. But I was on the phone last night with Dr. Rochelle Walensky, who's the head of the CDC, of course. And she said they really are looking to figure out, is this the tip of the iceberg or is this something that's going to pass? They put out a call for cases. They're saying to people out there, doctors, clinicians all around the world, certainly in the United States, please be on the lookout for this.
Is it too early to say what's causing it?
Well, they're associated with a virus that's a very common virus called adenovirus, and in some kids, a certain subtype called 41. But adenovirus is very common. It causes respiratory symptoms, GI symptoms. 41 subtype usually causes nausea, vomiting, diarrhea, and some respiratory symptoms. But it is not known to cause this type of hepatitis in normal kids. In immunocompromised kids whose immune systems are depressed, yes, there have been some case reports of hepatitis, but it's very mysterious right now.
And when you look at the facts of this, none of the children had COVID, and they weren't vaccinated, so there's no tie to vaccines in this case.
Not in the United States, but in Europe, 19 of the 169 cases were co-infections of adenovirus with the hepatitis. But what does that mean? We're not sure because it's very common. We're still in a pandemic.
So symptoms? That's what, yeah.
That's a question.
Every parent looking at you
right
now.
John,
give us the symptoms. Yes. Yeah.
Okay, so nausea, vomiting, diarrhea, which of course can
that covers a lot of things.
A lot of very common things. You can have respiratory symptoms. One of the big things is jaundice, right? So if you turn yellow, and sometimes it may be tough to see that, believe it or not, especially a person of color. So if the urine turns very dark, like brown, that's from breakdown product of bile of the red blood cells that ends up in the urine. So that's a little clue there. But also follow your gut. As a parent, I always say, the kid's just not looking the way they should. Follow your gut feeling about it. Contact your doctor because there's a very easy way to see if you have this problem, which is to get a blood test. You can see that the liver enzymes are elevated. So it's not like these mysterious things where you say, well, I don't even have a test for it. There's a good test for it.
Well, so how is it spread, though? Because I think a lot of, is it kid to kid?
Prevent it?
Is it, adult to child?
Right. It's both respiratory, so in the air we know about that, but also something called fecal oral, which means...
What does that... doesn't sound good. What
right.
Does that mean?
Let's really...
Conjuring up a bad picture.
It's icky, but let's really talk, and we talked beforehand, so
what does
let's
it mean?
explain this. So when a kid poops, right, and wipes themselves, they don't always do a perfect job. They may get a little bit of stool on their finger. Now the virus is on their hand. They touch somebody else. They touch an adult. The adult then has it on their hand. They touch their mouth or their eye or their nose.
Touch a kid in school.
Touch another kid in school.
Right.
So that's, I know it's kind of icky to talk about this, but that's the bottom line. It's one of the ways that it spreads. And that's why hand washing is so important.
What's the treatment, John?
Supportive care. There are some experimental antiviral treatments out there. There's nothing FDA approved yet that says, okay, this is how you treat it. Same thing with a vaccine. There's no FDA approved vaccine for this for kids, but it's supportive care, meaning they come into the hospital. Fortunately, yes, there were 17 kids around the world who needed liver transplants. I spoke to somebody at the University of Alabama who was involved with the 9 kids there, including the 2 who had the transplants. They're all doing fine right now.
Good.
So they do supportive care. They give them intravenous fluids and oxygen if they need it and things like that. But so far, these kids are getting better. But one of the worst things you can do in medicine is to say, oh, it's adenovirus, done, I know what it is. No, we have to declare this. We don't know what's going on. We're going to keep our eyes and ears open, and we're going to just keep the hypotheses coming in.
Well, we really appreciate all the information. Obviously, we had tons of questions about it, so I'm sure parents at home did too. Dr. Jon LaPook?
There's one last theory, which is, I just want to quickly say, which is that during the pandemic, there haven't been as many infections of adenovirus because kids are home where they're wearing masks. So one theory is that, maybe now they're suddenly be exposed to it. They didn't realize that early on that, this is something that's normal, and they overreact in their immune system. That's one really kind of interesting theory.
We'll have to keep an eye on that. Dr. Jon LaPook, thank you so much. Appreciate it.